Hello YouTubers, Liver Flesh Man here today. Gonna talk about castor packs. Gonna talk about vitamin A and vitamin E oil with the castor packs, and this is all about reversing cirrhosis, reversing fibrosis of the liver, and reversing fatty liver disease through castor oil packs and vitamin A, vitamin E in the castor packs as well, or an additional aloe vera gel or shea butter. Right, these are all really good things that actually reduce inflammation in the liver, located in the lower, beneath the lower right rib cage, just underneath, and the bottom rib cage ribs protect the liver. And so what happens is when you put the castor pack on, I got another video on how to do the castor pack, but basically what you do with that is you put castor oil on a cotton cloth, right, and then you place that over your liver, and then use plastic kitchen wrap around your body to hold it there, and then you can wear a shirt or whatever, and then put the hot water bottle, like the rubber bottles, hot water in there, and then place that over your liver, and that helps to absorb the heat, actually absorbs and helps the castor oil and vitamin A and vitamin E, aloe vera or shea butter, all these ingredients you can use. I recommend castor oil for sure, but vitamin A and vitamin E are really excellent oils that help reducing in the scarring just as well as the castor oil, because it reduces inflammation and the scar tissue. It helps to dissolve it a bit and make it a bit more smooth and get rid of the scarring tissue and bring it back a little bit to more regular tissue. So cirrhosis has basically 6 stages of cirrhosis, and the liver progresses from healthy liver to a fatty liver, then a fibrosis liver, fibrosis of the liver, or liver fibrosis, which is the scarring begins to form. In fatty liver, it inflames and gets larger, the liver gets larger, and that causes swelling and scarring of the tissue, which leads to fibrosis, fibers of the tissue, scarring of the tissue. And then there's 6 stages of fibrosis, which eventually, in the later 5 and 6 stages, the scarring tissue begins to happen around the portal vein area of the where the liver and the heart coincide through the portal vein, and that's where, if a lot of scarring happens around that portal vein, that is to the degree it goes from fibrosis to cirrhosis. And the stages of cirrhosis, depending on the severity of scarness and the amount of scarring, and especially around the portal vein area, because that's where the liver actually filters a huge amount of blood for our body daily, like a huge amount. And it's also more brain, 3 times more blood goes to the liver than the brain, because the liver is so important with the blood. So with the the cirrhosis of the liver goes to 6 stages, to the degree that the scarring happens around this hepatic portal vein area, where actually the blood flow happens. So if the blood flow gets limited and it's not being filtered, that's what leads to liver cancer, liver failure, and necrosis of the liver. Necrosis of the liver can actually be gone to the point where it's almost unreversible back to a healthy liver, but you can maintain a level at necrosis and potentially even reverse it, depending on your lifestyle that you've lived and stuff, to reverse the cirrhosis. But in general, that includes from a necrosis liver or cirrhosis in the late stages 4, 5, and 6, require a whole transition into a raw food diet, a high percentage raw food diet, in order to get the live enzymes. These enzymes are important in liver function and liver rejuvenation of new cells and liver herbs and stuff. What you want to do is reduce the scarring, which is the castor packs, the vitamin A and vitamin E castor packs, as well as aloe vera, like I said, to reduce the inflammation and the scar tissue. This scar tissue has to rejuvenate, has to dissolve and then rejuvenate new scar tissue, so the liver can actually rejuvenate and regrow and reverse from cirrhosis back to a healthy or fatty liver. are, depending, you're reversing from cirrhosis back to fibrosis and so on. You're reversing the stage from getting progressive liver disease back to a healthy liver potentially, which involves following a liver flushing diet, which I recommend. All the videos I have are all about raw food recipes, like the manna bread dessert would be one for getting the fiber with the manna bread, the live living enzymes in the bread, and also like all those detox drinks such as the Master Cleanse, the liver electrolyte drink, the OxyMag drink in combining with the liver flush. So soon I will be doing an advanced liver flush protocol, which for now you can find at liverflushing.com. Alright, if you've done, say, half a dozen or a dozen liver flushes and you've been eating a good diet, you might be ready for the protocol at liverflushing.com. But that is the basic video. If you need to learn how to do a castor pack, I basically just explain how you place the cloth over, soak with castor oil, and place the heating bottle. So that's all it is castor oil absorbing into your liver. But the vitamin A, vitamin E, and this is reverse fatty liver, reverse fibrosis, reverse cirrhosis. It's just amazing treatment for inflammation of the liver in general. If you have hepatitis, this would be good to do on a regular basis, like a couple times a month or even once a week, So there it is. That's how, because and vitamin A and vitamin E has been known to reduce scarring, all on the outside of the body, on the exterior. So it also applies the inside, and by applying that heat with the hot water bottle, that allows those oils, castor oil and vitamin A, to absorb into and reduce the scarring in there. And this is what's going to cause you to have a healthy liver again. Alright, so that's it. That's Liver Flush Man for reversing cirrhosis, necrosis, fatty liver, fibrosis, even maybe liver cancer. Because after you've changed the diet and got the liver strong, then a series of liver flushes where you're getting all this toxic stone and waste in a physical, actual form that inhibits the function of the liver, you get a large amount of these stones out and your liver is at a whole new level, and it will rejuvenate and go through its stuff. And in general, the liver doesn't have signs that it's not doing well. The signs that may happen are basically back pains and side pain around the liver. But in general, the liver doesn't have a lot of neurons that can feel pain and stuff. So a lot of people will develop fatty liver or even go as far as cirrhosis and not feel much pain or notice anything. So that's kind of the symptoms. Are there no symptoms within with the liver conditions and problems? So best to go get an enzyme liver check or get your blood checked, and these are ways for them to see about liver enzyme counts, and if they're high, then they may do an ultrasound or to check to see if you have stones possibly. But I must say, even if the doctors say that they didn't find any stones in the ultrasound, it doesn't mean you might not still have thousands of stones. And even these medical doctors aren't informed really. Maybe they know on some level, but they just kind of hide it under the rug that even these stones just haven't become hard and calcified to the point where they harden and become hard with calcium and protein and stuff, biopigments and salts, bile salts, and cholesterol, lipids, fats, and stuff all congealing together. Then that's the problem is those will become calcified with time and age and rising bilirubins in the liver and blood. But that's the thing. You may still have the stones, and you probably do. I would say by the age of 16, for most people with the diet we eat in today's world, have hundreds, if not thousands, of stones already in their liver and gallbladder. And I've done some research to see the stones seem to originate in the liver, produced in the liver, and then get dumped into the gallbladder later. That seems to be the general consensus. I would like to know, maybe they can also form in the gallbladder, but they're mostly produced in the liver because the liver is so powerful and has so many functions that those stones get dumped eventually through the bile ducts, and the bile ducts could get plugged up and stuff like that, and that's where pain may start happening eventually if it's been plugged up and stones are getting stuck in there and stuff. So let's reverse the fatty liver and get these stones out of our bodies. Let's clean up the diet and do the proper preparation and put the proper time that preparation deserves to do a series of liver flushes if you have fibrosis or cirrhosis, and in the late stage of cirrhosis, even more so, you gotta discipline that diet and prepare before that flush, just as I did 4.5 years of 100% raw food before I did 120 liver flushes, because I prepared myself for that jump into the huge amount and 100 plus liver flush with stones. Alright, so that's the reversal of cirrhosis. Thank you, liver flush man.